Roger Marshall knows better. He just doesn't care. Roger Marshall may be just another empty suit in Washington, but he's also a doctor. He took an oath to do no harm. He knows exactly what it means when families can't afford to see their doctor, when prescriptions are skipped, when preventative care is delayed until it's too late. He's seen it with his own eyes. And yet, as Kansas families brace for healthcare premium hikes of thousands or even tens of thousands of dollars next year, Marshall is not fighting for them. He's leading the charge to let critical Affordable Care Act subsidies expire, using the government shutdown as political leverage to do it. These subsidies were first enacted in 2021 to make health insurance more affordable and extended through 2025 by the Inflation Reduction Act. They have been remarkably effective. Since they were introduced, enrollment in the ACA Marketplace plans has more than doubled, from roughly 11 million to over 24 million Americans. The vast majority of those enrollees received the enhanced subsidy, which caps the share of income they must pay for coverage and fills in the rest with a federal tax credit. Because of that assistance, the average person with subsidized coverage currently pays about $888 a year in premiums. According to the Kaiser Family Foundation, if the subsidies disappear, that figure would jump to $1,904 in 2026. That's a 114% increase. The enhanced subsidies have been a lifeline for moderate income families who previously earned too much to qualify for help, but couldn't actually afford unsubsidized premiums. Without the enhanced credits, the average Kansas family would pay between $1,200 and $1,400 more per year, with many families facing several $1,000s in new costs overnight. Some would be forced to drop coverage entirely. Marshall knows exactly what will happen if those subsidies disappear. Premiums for more than 20 million Americans will more than double on average. For Kansas families, that means over $3,000 ripped out of a typical household budget. A 60-year-old couple in rural Kansas could see their bill soar by more than $22,000 in a single year. These aren't projections he's unaware of. They're basic health economics any physician understands. He's not confused. He's not misinformed. He's choosing. He's choosing to raise costs on Kansas families so his party can hand out more corporate tax breaks. He's choosing to jeopardize people's health to score political points in Washington. He's choosing politics over patients. Marshall took an oath as a doctor to care for the sick, to protect lives. But in Washington, he's become something very different. A career politician willing to use his medical credibility to sell a policy that will hurt the very people he once pledged to heal. That's not leadership. That is betrayal. This fight isn't about polling numbers or partisan theater. It's about whether a mom in Logan County can afford her child's checkup. It's about whether a couple in Lawrence can keep their coverage without being crushed by premiums. It's about real Kansans who will pay the price for Roger Marshall's political games. Roger Marshall knows better. He just doesn't care. And Kansas families deserve a senator who does. If you want to find out more, check out the link to the Kaiser Family Foundation study in the description below. Reach out to me directly via my website at www.annforkansas.com, and that's Ann with an E. We'd love to have you as part of our team. Join our movement, whether monetarily or with your time. I look forward to hearing from you.